Hello everyone, good afternoon. My name is Rachana. I am third year nursing student. Today I'm going to talk about the role of nursing in meeting the diverse health and well-being needs of 12 to 18-year-old vaping community. Vaping has become a significant health problem due to its rising popularity among teenagers, especially those between age of 12 to 14. To raise awareness, conduct risk assessments, educating caregivers, and working with multidisciplinary teams, nurses have a major role in addressing this issue at the community level. Nurses have a critical role in educating teenagers, their families, and others in the community about the risk associated with vaping. As nurses, we can initiate discussion about vaping, clarify their misconceptions, and offer accurate information to the public. Some people may think vaping is less dangerous than smoking. Nurses can explain about the e-cigarettes that includes chemicals that are harmful to young people's developing lungs and brains, including their drug nicotine, toxic substances, and carcinogens. Nurses can also utilize the social media and school health programs to outreach the community and helping interacting with the teenagers and their caregivers to provide easy accessible teaching materials such as fact sheets, booklets, and online resources. Research suggests that school-based interventions have proven particularly successful in reaching youth and providing them with information that they need to make wise decisions around vaping and its consequences. As a nurse, we can identify teenagers who are at risk of starting to vape or who are currently vaping by screening for their vaping habits during routine health visits. They we can assess their family status, background screening, and mental health screenings to assess environmental factors that could encourage them vaping, such as social media impact, parenting, or peer pressure, or the easy availability of vaping items. Risk assessments provide nurses with the ability to personalize interventions to meet the specific needs of each patient, addressing individual risk factors and improving the efficacy of preventative measures. Adolescents who are addicted to vaping are frequently dealing with the stress, anxiety, and other mental health conditions. To discontinue, for discontinuation to be effective, these underlying psychological issues must be resolved. As nurses, we can assist in referring adolescents in to mental health specialists such as school psychologists or who can help them manage their issues. Um, the Journal of Adolescent Health 2020 believes that as emotional and psychological health are strongly correlated with substance use behavior, therapies for mental health must be incorporated into vaping cessation strategies. For those with a nicotine addiction, for example, they might require specific medical attention such as counseling behavior or nicotine replacement therapy (NRT). As case managers, nurses can make sure their treatment is organized and that their progress is monitored in time. Additionally, nurses can also engage in educating with other health professionals such as teachers in the school, counselors, and youth workers who might not be completely aware of the potential hazard of vaping and symptoms associated with it. To improve the ability of these professionals for guiding youth in quitting vaping, nurses could provide them with informative resources or training sessions. They can also collaborate to establish positive learning environment in school where children can feel free to ask for assistance without fear uh, of rejection or shame. According to the Journal of Radiology Nursing 2022, it suggests that it is critical for school professionals to recognize symptoms and finding associated with lung injury secondary to e-cigarette and vaping use in adults. The prevalence of misleading data is one of the main barriers to eliminating vaping. Vape contains chemicals and nicotine. A lot of young people perceive it to be safer than traditional smoking. Additionally, it can be difficult for health professionals, particularly nurses, to remain ahead of the trend when it comes to providing up-to-date information due to the fast development of e-cigarettes technology and marketing strategies. Also, social media and peer pressure have a big impact on teenagers, which hinders prevention efforts. The accessibility of vaping products, which are frequently marketed in the way that it appeals to young people, such as they sell flavored products. That poses another concern. A lot of places now lack proper rules and regulation on electronic cigarettes, which make them easily available to the minors. And one of the example is illegal selling of those products. By implementing new methods, nurses can increase their current role in education. Example of such initiative involves advocating for strict rules and regulation against vaping and introducing more digital campaigns. Public health experts, social media influencers, and nurses can work together to create focused online campaigns given the considerable impact that online and social media have on young adults. Campaigns like these can dispel misconception about vaping, draw their consciousness to its health risk, and provide resources that can help them to quit vaping. People who have digital literacy have a chance to connect with them in the social media sites and communicate about the process that is involved in reducing vaping habits. Using their professional knowledge to push for changes at the local, state, and federal level, nurses can take an active role in advancing policy such as banning flavored e-cigarettes, setting the legal age for purchasing vaping products, and also enforcing down on business who sell vape products to minors. In alongside zero tolerance guidelines campaign to educate students on the risk associated with vaping, on campus support networks for youngsters trying to stop. Nurses may advocate for stricter anti-vaping regulation to be implemented in school. By adopting these effective methods, as nurses, we can play a major role in raising awareness um, of the health issues linked to vaping among the community while advocating for their better lifestyle choices.